In this video, we're going to look at how we manage our patient lists within EPR using the clinical work list function. So when we look into EPR, we can come to the menu at the top and select work list, which will bring up the clinical work lists. Now, clinical work list can take one of two forms. If you click on the top left of the screen, the drop-down menu where it says the list, you've got two choices. You can select a care team list or a patient list. So patient list will mirror the patient list that you already have with an EPR, and you can set these up to be ward-based or custom list where you can manually add patients. The type of list that we use in Transplant is called a care team list, which is where you assign a patient to an individual care team, which is generally defined by a treatment function like transplant surgery, renal, for example. And we manage our lists within these. The advantage of using a care team list is that other users don't have to be proxied or given permission to be able to see your personal list. This is a general list that anybody in the organization can see. So if we select Manage Care Team Lists here, you can see on the right hand drop down, you can select any of the treatment functions available within the trust. In this case, we're going to use transplant surgery, and I already have that selected in the checkbox here, which means that I can now select the transplant surgery work list to work with. So when I first open the transplant surgery work list, you can see that all of the patient information within this list is grayed out. So I can't see any of the information. So the first thing I need to do is to establish a relationship with the patients on the list. I can simply click Establish Relationships, select all, select my relationship with the patients, and then press Submit. And now all of the grayed out boxes will go, and I can now see all of the patient information for the patients within my work list. So the next thing you're going to want to do is to set up your columns to show information that's useful to you. And the way we do that is to go to the top right hand side where there's a little hamburger menu, the page menu, and if we click on this and then click on Layout Configuration, you can see I've got a whole choice of different columns that I can select, and I can drag up and down to rearrange here. So the first column will always be your patient's details, so name, NHS number, age, and so on. And then we can add or remove the other bits of information depending on what we want to see. So for managing an inpatient list for medical staff, the ones that are generally most useful are location, medical tasks, the iPass summary, which I'll show you in a second, the actions column, the diagnosis column, the chronic problem column, the plan column. If we're managing patients within an individual speciality, we don't really need that. The results to endorse column can be useful. You may or may not need the consultant column depending on the way your ward is set up. And generally we don't need the ward staff, resus status or respect plan for managing medical patients, but you can have any of these that you feel may be useful. The selected labs column can also be quite useful as well. And then we can drag these up and down to change the order as and where we want them. So I'll move my diagnosis and my chronic problems columns up to the top so they'll appear on the left hand side. So once you've done that and got it to how you want it, you can click apply, and after a short delay this will then update itself and show you this information for your patients. So now you can see, I can see the diagnosis, which is the reason for the current encounter, the reason for the current admission. I've got my list of chronic problems here, which is my problem list within EPR for long-term patients, long-term complications and issues that continue between encounters. And if you click on any of these, you pull up a right-hand menu bar which shows you the information relating to these, and you can edit any of these bits and pieces. And the same here goes with the diagnosis. And you can pull up other sections of EPR from within these right-hand panes. So if I want to add or remove patients from my work list as patients are admitted or discharged to the service, I can simply click the Add Patient button at the top here. And I can search by MRM, by NHS number, or by name. And if I find a patient, I can then select that patient, select the correct encounter, and click OK. And that patient will then be added to my list. If I want to remove patients from my list, I click the little Select Rows button at the top right-hand side. I can select any number of patients here and then click Remove. So once my list is set up, I can add and remove patients as they're admitted or discharged to the ward. The next thing I want to be able to do is to add further information about these patients. So we've already looked at diagnoses and chronic problems. So the next thing you might want to do is have a textual summary of that patient's progress for this admission. So the way we do that is we use what's called the iPass function. An iPass is designed for handing patients over. So if we look on the left-hand side here in the column with the patient's name in, there are two things you can do here. If you click on the patient's name, so the hyperlink, that will take you directly into that patient's record within EPR. If you click anywhere else in this box for this patient, it'll bring up a window on the right-hand side which shows you the iPass summary for this patient. And here we can define the patient's illness severity. We can type in a summary of the patient's admission. And we can put in tasks or actions that we need to perform for that patient. So I might say I need to request a chest x-ray for this patient, for example, and I can either make that available to my care team or to all users of EPR. And then the planning section, I can add a plan for this patient or situational awareness. Like so. And so once I've done this, if I close and refresh my screen, you'll see that some of this information starts to populate our work list. So this patient at the top, you can see that I've added a summary of the patient's admission. I've added an action here, and if I click on that action, I can either add further actions here or mark that action as having been completed. And I can see the plan for that patient as well. Other useful columns in here, medical tasks will show you outstanding medical tasks for a patient. These are system automated tasks, things like your VTE assessment, your cognitive screen. If there's anything outstanding for a patient, it will show in this column. The results to endorse column will show the text results to endorse if that patient admitted has any unendorsed results. And if you click on that column, you will be able to go in, see those results, and endorse those results directly from the work list. The selected labs column is also quite useful. It shows you a summary of the most commonly looked at blood tests, so HB, white blood cell count, platelets, CRP, creatinine, and so on, for the last 3 days. The other very useful feature that you can access from within a clinical work list view comes again when you click on a patient's within the left-hand column. You see the default view is the iPass, but there's also a tab here called Clinical Data. And if you click on Clinical Data, you can immediately see that this brings up a very nice patient summary. And this patient summary is showing us the last few days worth of observations, the last few days worth of laboratory values, the current medication list, and a very nice summary view of the patient's fluid balance. This is very useful for handover or board rounds if you're using those within your service.